My name's Karen Logan. I'm a nurse consultant and head of continence services at Newport in South Wales in the UK. I've been a continence nurse and a urology nurse for nearly 20 years now. The average is about 4 to 6 times a day, but it will depend very much on your individual circumstances and your residual urine measurement and what your nurse has instructed you to do. Intermittent self-catheterization doesn't actually hurt. It causes a sensation, sometimes makes you feel like you want to pass water, but if that sensation doesn't pass, then you need to discuss it with your nurse. You just need to relax. Sometimes a warm bath will help, sometimes giving a cough will help to relax the urethral sphincter. Some people have to catheterize for life, but for some people it's only a temporary measure. You should be aiming to drink at least 5 to 8 glasses of fluid a day. Yes, you can travel overseas no problem at all on holidays or business trips, as long as you remember to take plenty of catheters with you, calculate the number of catheters that you need, and it's often useful to take a certificate with you that the companies provide to help you should you have any issues with customs, or your doctor will write you a letter to explain that you're carrying the catheters for your medical condition. If there's blood in your urine, keep a close eye on it and be vigilant. If it doesn't clear, you need to get in touch with your nurse or doctor. You should always look out for symptoms of a urinary tract infection. For example, any smelly or odorous urine, cloudy urine, pain or discomfort, fever or shivering, or persistent blood in your urine. And if you have that, you should seek help from your GP or your local doctor. Catheters don't cause damage to the urethra or the bladder. It's one of the biggest fears of patients, but they generally will just coil up in the bladder. They can't make a hole in the bladder and they can't cause you any damage. You should be using a catheter that has a low friction hydrophilic coating, that has a history and reputation for safety and quality.
Urinary tract infections, or UTIs, can be a potential issue for women who see IC, even if the risk is much less compared to other methods of emptying the bladder. UTIs occur when bacteria get access to the bladder. They grow, and if not flushed out regularly, attach to the mucous membrane of the urethra or bladder wall. That's when they start to cause problems. But there is plenty you can do to avoid UTIs in the first place. Minimize introduction of bacteria to the bladder. Always wash your hands before catheterizing. Wash your genital area. Try not to touch the tube. Minimize bacteria growth. Empty your bladder regularly to wash out bacteria. Your total volume should not exceed 400 milliliters at any time, which also protects your bladder wall. Make sure you empty your bladder completely. Using the right technique and the correct length of catheter helps. Minimize the ability for bacteria to attach. use a low friction catheter, such as a LoFric catheter with urotonic surface technology. This catheter has documented proof of reducing long-term complications. The tube is slippery at both insertion and withdrawal, preventing damage to the mucus and making it harder for the bacteria to attach and grow. The symptoms of UTI can differ and include the need to urinate more often than usual, burning sensation when you do, fever, tenderness in the bladder area, blood in the urine, cloudy or smelly urine, and just generally feeling worse. It's easily treated, but very important that it is treated. If the infection is allowed to grow, it could reach your kidneys, and that would cause problems. So, if you have the symptoms, see your doctor or nurse as soon as you can. But also keep catheterizing as needed until you do.